Good afternoon. My name is Selena Moore, and here at the School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Referring Adolescent Patients to Dental Services. During today's engaging presentation, attendees will receive training resources, health center materials, and strategies for helping young people assess the youth-friendliness of dental practices in their community. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based health care. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to the health care services that they so desperately need. School-based health care is the solution, bringing health care to where students already spend the majority of their time, in schools. When health and education come together, great things happen. Attendance improves, conditions like asthma or diabetes are better managed, behavioral health issues get quick, expert attention. And we all know that healthy students make better learners. Now we have a few housekeeping reminders. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the Q&A tool located in your Zoom control bar. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we're doing. Your feedback is vital in helping us craft presentations that meet your needs. The webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance's website for additional archive webinars for topics such as the ones you're viewing on your screen. Now to our presenters. Lauren Rinaldi became the director of the Adolescent Health Initiative in 2013. She has a master's in public health from the University of Michigan and a Bachelor of Arts in Psychology and Education from Washington University in St. Louis. Her previous leadership experience includes roles with the federally qualified health centers and community-based organizations in Illinois and Michigan. She previously served as vice president of the Michigan chapter of the Society for Adolescent Health and Medicine. Ellen Wagner joined the Adolescent Health Initiative as project director in the summer of 2016. She has a master's in public health from Columbia University Mailman School of Public Health and a master's in basic medical sciences from New York Medical College. Ellen was previously based in New York City, where she led patient outcome improvement projects in a variety of settings, including a large health and human services agency, public hospitals, and academic medical centers. Thank you, everyone. I will now turn it over to our presenters.
All right, hi everybody. This is Lauren Rinaldi and Ellen Wagner. Hello. We are excited to join you today from the Adolescent Health Initiative. And then move over here, Selena. We are not able to advance the slides right now. If you could give us that control back.
You should have it now.
Thank you. For those of you who aren't familiar with the Adolescent Health Initiative, we're based out of the, oops, let me go back now. We are based out of the University of Michigan, but we provide training and technical assistance and coaching to healthcare providers, health systems, and organizations across the country to improve adolescent-centered care. And as you can see here, our vision is to transform the healthcare landscape to optimize adolescent and young adult health and well-being. Our website is listed below, and we'll also have it for you throughout the presentation so that you can access many of the resources that we're going to be talking about today, as well as a lot of other things that we have available to you. So here is what you can expect from today's training. First, we're going to discuss some of the reasons why dental care is important for adolescents and young adults. Next, we're going to demonstrate for you a brief training called a Spark that you can share with the rest of your team. We're going to then briefly review the Spark model and dive into how you could deliver this at your own organization. And then finally, we're going to share some additional resources on adolescent oral health and youth-friendly services. I'm going to hand it over to Ellen to get started. Thank you, Lauren. So why referring to oral health services matters? To set the stage for the Spark training that we're going to do in a minute, we're going to talk about some of the information and reasons that it's important to routinely refer young people for professional dental care. So good oral health, as we know, can reduce the occurrence of oral health diseases and prevent irreversible damage. It also contributes to improved school attendance among adolescents. But unfortunately, utilization of oral health services has been found to decrease during adolescence. Less than half of adolescents ages 13 to 20 received dental care in 2004, compared to 59% of children ages 6 to 12. By age 17, 68% of adolescents have been affected by a dental carie or cavity. And by age 18, 82% of adolescents have had some type of gingivitis. Compared to moreover, compared to their more affluent peers, adolescents from low-income families are more likely to experience tooth decay and less likely to visit the dentist for preventative care. So in order to address this need, the Spark training that we're going to present today focuses on building the capacity of health centers and other youth-serving organizations to connect young people to essential dental services. So we're about to begin the Spark presentation, and Selena, if you could give us the chat feature back, we don't have it on our screen, and we're excited to have people chat in some responses during our presentation.
Will do.
Thank you. Thanks everyone for bearing with us for just a moment. Yes. So in the meantime, this Spark training that we're about to do is something that is designed, as Lauren mentioned, to be done in your health center setting with your team that you work with. And we're going to talk more about what that looks like after the Spark. But for the purposes of doing this training now, just one moment, I'm pulling up the chat feature. Great, thank you, Selena. We have the chat feature now. So as I was saying, for the purpose of doing this Spark now so that you can see what it would look like or imagine what it could look like, we're gonna pretend we're all on the same team. So I'm gonna ask you to just envision that you're sitting around your typical conference room table with people that you work with, and somebody from your team is leading the Spark. There's a script that goes with this Spark so that anybody on your team can lead it, and I'm actually just gonna read the script so that you can see what it sounds like if somebody is just using the script and the slides to really demonstrate for you that anybody really can do this, even if you're not an experienced presenter. Hi team, how is everybody today? I'm so glad we were all able to come together. The next item on our agenda is this 15-minute mini training, also called the Spark, which is intended to spark discussion and learning. This Spark is focused on adolescent dental health and referrals. When thinking about referring young people to health services, oral health may not be the first thing that comes to mind, but we have the opportunity to reinforce the importance of dental care for adolescents in some quick and easy ways. Sorry, there's a slight delay in the slide advancing. Perfect. Okay. So we're going to start with a quick brainstorm. So how might it feel to visit the dentist as a teen? Please take a minute to think about this and chat in some responses that you might have. Yep, I see a couple people saying that it felt scary. It might feel scary to visit the dentist as a teen. Anything else that comes to mind? And what might make a visit to a dentist different for a teenager than an adult or a child? That might help think about what might, how it might feel as a teen. So what might be different about it when you're visiting the dentist as a teen? I agree. Scary, intimidating is something that comes to mind for me, not really knowing what to expect. Yeah, parents are not always with the teen. That's another thing that could be challenging about visiting the dentist as a teen. Worried about appearance. Yep, and appearance of your mouth too, I could imagine. School-based programs giving students their first experience with the dentist, right? Maybe a young person has never been to the dentist before. So it might feel different if you're going to the dentist and that kind of through that avenue. Great. So what are some reasons why teens may avoid going to the dentist? Yeah, the students, I see somebody also saying that students may be nervous about building a relationship with the dentist. They may be embarrassed. Not a priority. Yeah, if you're not currently feeling any pain or having any problems, it may not feel like something that you need to immediately work on doing if you're a young person. Great. So the purpose of this discussion is to help us think back to our own experiences as young people and to remind ourselves that it might take special effort for us to consider the need of the youth that we serve. Yeah, young people have had bad experiences, exactly. So what might happen when teens don't feel comfortable with their oral health care experiences? Chat in some responses. Yep, they might avoid them. Maybe they're not going to come back. I could also imagine that they would tell their friends they had a bad experience, and they would maybe not have things to say to their friends that make them want to go to the dentist. They won't come back to the dentist as an adult. Exactly. They won't come back as a teen, and probably not as an adult either. Great. All right. Right, they might not take the recommendations from the dentist. That's a great point. And what might happen when teens do feel comfortable with their oral health care experience? I can imagine the opposite of some of these things. They would maybe take the recommendations of their dentist. They would tell and encourage their friends, absolutely. Great. And they will hopefully come back as an adolescent and as an adult. So in the next few slides, we're going to read some quotes from teen patients. After each slide, think about to yourself about how each young person might feel about going to the dentist. So the following is a story from Cicely at age 17. My mom recently reminded me that I need to schedule my next dentist appointment. I thought I would have to call and actually talk to someone. I was not looking forward to that, but they have online scheduling on the office website. That made everything so much easier. Dentists can sometimes be like robots, just going through the process. There's not much conversation with the provider, and when they do ask, it's when they're in my mouth. I don't feel like there's a personal relationship at all. Dante, age 15. I feel very anxious about my dental appointments. I've had some unpleasant experiences. The dentist always tells me all the things I'm doing wrong, like not flossing or questioning my eating habits. I rarely ever look forward to appointments. This is a quote from Dorian at age 13. My dentist office is really cool. They do a cavity-free month activity. They put your name into a drawing if you have no cavities, and they pull a name to win a $100 gift card. Now that we've heard some individual perspectives, let's look at the bigger picture. Dental care is the most prevalent unmet health need in the United States for youth. According to the CDC, dental caries or cavities remain the most common chronic disease of young people, affecting 59% of adolescents ages 12 to 19. As we know, many oral health conditions, including cavities, are largely preventable with regular visits to the dentist for oral exams, professional cleanings, and education. So now we're going to review some data related to oral health in the United States. We're actually going to launch this as a poll, and there are 4 items. I'm going to read each item aloud, and I'd like you to use the poll to vote on which answer you think is correct. So Selena, if you're able to launch the poll. Okay. Question 1. In the United States, over blank million school hours are lost annually because of illness related to dental problems. So select the response that you think is correct. You can actually type it right into the poll as well as the chat feature, and we'll tabulate it that way. Number 2, blank percent of adolescents ages 12 to 19 have untreated decay in permanent teeth. Take a minute to think about what that correct answer may be. Number 3, which of the following diseases have symptoms that can be detected orally by a trained provider? A, diabetes, B, bulimia, C, leukemia. And finally, results of the 2016 study at the University of Illinois showed that blank percent of providers reported not referring any patients to a dentist in the past year. So select which answer you think is correct. I'll give everybody just a few more seconds to fill in your responses, and then we'll look at the results. Great. Selena, can we see the results? Okay, so it looks like some variety of answers. Maybe not everybody is on the same page. We'll just peruse through this, and then we'll go through what the correct answers are. So take a look at all of these answers and think to yourself what you responded, and we'll go from there. Great. I'm going to close the poll and go back to the slide. So question 1. I'm just working on pulling up the answer. So in the United States, over 51 million school hours are lost annually because of illness related to dental problems. So I saw many people selected less than that. It is pretty astonishing. So decayed teeth can cause pain in the mouth that affects the student's ability to focus during the school day. Youth who have poor oral health are 3 times more likely to miss school due to dental pain and receive lower grades than children who don't. 39% of adolescents ages 12 to 19 have untreated decay in permanent teeth. Untreated cavities can cause pain and infections that may lead to problems with eating, speaking, and being active. So which of the following diseases has symptoms that can be detected orally by a trained provider? Diabetes, bulimia, or leukemia? All three. So all three of those. All of these diseases can be detected orally, and teens who visit the dentist regularly have a better chance of early diagnosis and treatment. Finally, results of a 2016 study at the University of Illinois showed that 52% of providers reported not referring any patients to a dentist in the past year. This one is particularly astounding to me. The physicians in this study identified the lack of an adequate dental referral process as the reason for low referral rates. One important step to referring young people to dental services is making a referral guide. Develop a list of providers and resources that young people may need to access dental services. This list can be vetted by organization leaders and community partners as well. And it may also be a good idea to designate people in your organization to reach out to local dental offices to build rapport and set up a referral process. When contacting dental practices, remind them that there are some services minors can access confidentially or without parental consent. Encourage them to remind young people about this and refer patients back to us for confidential care. Another key part of having a referral list is to make sure it is visible and accessible to those who may need it. The list is only effective if people know about it and can easily access it. As important aspect of identifying providers for the referral list is to make sure that places you're recommending are youth-friendly. A nice way to do this might be to ask youth if they have suggestions for dentists they have visited. Your team could also designate someone to assess the youth-friendliness of local dental offices. Here are some examples of what a youth-friendly dental office might look like. So offers services that are accessible to youth. This includes flexible scheduling hours and an up-to-date website and options of same-day appointments. Creating a welcoming environment for young patients, having magazines for teens, cell phone charging stations, and easy-to-understand forms. Use strengths-based approaches to care where providers acknowledge healthy behaviors and encourage youth. Encourage adolescents to return for follow-up care and offer text reminders to adolescent patients or upcoming appointments. And collect feedback from adolescent patients by asking adolescent patients to complete surveys about their experience. It's important to note that all dental practices may not implement all of these strategies at their offices, and that's okay. The important thing is that the offices make young people feel welcome and valued. So let's close by thinking about what we can do to encourage youth to take charge of their dental health. What can we do to make or strengthen our dental referral guide? And then thinking back to our earlier discussion on challenges young people face, what are some ways we can help them get to the dentist? So take a minute and think through those, and feel free to chat any responses that come to mind. Bringing the services to the adolescents, definitely. If there's a way to make them more convenient to access, I agree. This is also typically a nice activity done when you're sitting in your team setting and you've got folks on your team that can brainstorm together how your team might make a referral guide given your structure and processes. Great. Sometimes when we hear from other people, they talk about how to make referrals part of their routine referral processes, checking in with patients about, when's the last time they've seen a dentist, making sure to kind of at that moment address any concerns that they might hear. Yep, we see someone saying young people need to inform us on what works. Exactly. So that was one of the next things I was going to talk about is how do you get information directly from your patients, from your youth advisory councils, from any of the young people that you work with. So making sure, you know, is this something that you can talk with them about if it's not an area that you've already addressed? A lot of times when we work with young people, we ask them a lot of things about our health center, but not necessarily about how we can connect them with other services. So it's a great way to engage your patients or your councils to get information about what's going to help get them to the dentist. Thank you. So thank you. To keep this conversation going over the next month, I'm going to share sparklers or case scenarios that relate to being youth-friendly. I'll post the sparklers around the office in places that you can easily see them. When you see a sparkler, take a moment to read the scenario and think of through the questions listed on the page about how that can help you think through referring young people for dental services. So thank you so much for your participation. Great. So as you can see, what Ellen just modeled is sort of a primer discussion, right? It's not a ton of content, but it's a way that you could talk with others in your organization to get this on your mind and think about what you could do for next steps. So we're going to talk a little bit more about how you could bring that back to your team, and then what other resources or strategies might be helpful in making some of these differences. So we've modeled the Spark for you, and we're going to talk a little bit about the format. So AHI offers a number of different Spark trainings on our website, and we'll talk about that a little bit later. But they all follow the same format. They're designed to be ready to use and implemented in about 15 minutes. So the first component is the hook. And the hook is what emotionally draws someone into the topic. So key concepts introduces the content, and the application and sparklers gives participants ideas on how to put what they've learned into action. So for the Spark we just did, the hook was the discussion on our own experiences as teens or what concerns teens might have. The statistics and case scenarios introduced the key concepts, and the discussion of youth-friendly strategies was the application portion. So now that you know what a Spark is, let's talk about how to effectively deliver one in your organization. As Ellen mentioned, the good thing is that you don't need to be a seasoned public speaker or content expert to deliver a Spark. What you do need to be is a facilitator. So can anyone share, using the chat feature, what do you think are some qualities of an effective facilitator? So some of the things that come to mind for me are making sure that you are managing your time well, adapting to your group's needs, being a clear communicator, feeling prepared. I like facilitators who feel kind of casual. Yep, I'm saying listening skills and questioning skills, and someone who can kind of be encouraging about the topic. And as you can see, Sparks are designed you know, to be ready to use, and Ellen was really just reading from a script. So to facilitate means to make things easier. So a facilitator wants to create a safe and supportive space for people to work together and learn by providing a structure for learning. So a facilitator is a person who can effectively and efficiently guide without directing, can bring about change without disruption, and assist people and groups in constructing their own learning. So Sparks are really designed to be delivered by a facilitator rather than a presenter. They're supposed to be conversational and spark dialogue, rather than being focused on transferring knowledge from the presenter to an audience. Let's keep that in mind as we continue. So these are some of the principles of adult learning, right? These Sparks are meant as mini professional development opportunities. So I'm gonna have Ellen just sort of click through one by one. So adult learners need to know what they need to know. Number two, they have a deep need to be self-directing. Oftentimes, adult learners have a really deep reservoir of experiences that can be a rich resource both for themselves and for others in the group. A lot of times we're motivated to learn something when we've had a recent experience or it feels like a kind of a real-time need or interest has come up. And finally, we attach more meaning to learning that we gain from experience than just from acquiring knowledge passively. We prefer to be problem solvers over subject-centered learning. And so I'm just curious, as an adult learner yourself, is there one or two of these that really resonate with you or jump out to you? Chat in a number from your screen. In 3 and 4, right, having a lot of experience yourself, getting motivated. Also 1 and 2, you need to know what and why you're learning something, and having a deep need to be self-directed. I agree. A lot of these resonate with me, and I personally feel like I'm an experiential learner, so number 5 is also one that jumps out at me. Thank you for sharing. So all of the Spark materials are available directly for download from our website. This is an example too of another one that we have on adolescent brain development, but they're meant to be ready to use. So they come with PowerPoint slides, a facilitator script, as you saw Ellen was reading just from the script, participant handouts, and then sparklers, which are the follow-up activities. The purpose of all of this is so that we know from working with health centers across the country that people have limited time and kind of bandwidth and capacity to develop trainings on their own, and that they really just want something that is available for use and can be done during regularly scheduled meetings. One of my favorite things I heard from someone recently who used a Spark was they emailed us and said, I found your Spark training on my website last night, and I used it in our staff meeting this morning. That's really how easy they're meant to be in terms of implementation. So just to give you a little bit more of a sense of what they'll come with and what they look like. So you can see on this slide, we have a portion from the Spark script on AHI Spark on being youth friendly. So at the top, it shows you what supplies you need, which often includes, a projector, laptop, speakers, any of the handouts, just to help you be prepared before the meeting. And you'll see that the script clearly notifies you when to switch slides with the computer icon on the title slide. The Spark scripts are meant to be written in a conversational tone. Occasionally, though, you'll see blue text providing the facilitator with instructions or prompting you on maybe an opportunity to tell a personal story or experience. And this is an example of what one of the sparklers look like. So the sparklers are meant to be things that you can either email out to your team or post in a break room in the weeks or months following to kind of keep the conversation going. So this here is an example of the scenarios and discussion questions that could be shared or sent out. So if you're thinking about using the Referring Patients for Dental Services Spark or any of the other ones that we offer, feel free to take a look at the menu of topics and see what might be a good fit for your community. As I mentioned, we have a large menu, so in addition to the Referring Adolescent Patients for Dental Services Spark that you participated in today, we have them on being an askable adult, strength-based approaches to adolescent sexual health, non-judgmental communication bias, adolescent brain development, and many other topics. And when you think about your setting, Sparks can be facilitated in a health center with the entire practice team, everyone from a front desk staff, medical assistants, social workers, physicians, and so on, really anyone who interacts with your patients. They can also be used for professional development opportunities with community partners. You could share the format or offer to facilitate a Spark in their setting. So we've helped organizations host Spark train-the-trainer sessions for partners in their community. In a moment, we're going to dig into a little bit more about what an adolescent-friendly dental practice might look like. But one of the things that we would encourage is if you have new or existing relationships with dental providers in your community, it might be a nice opportunity to do a little bit of shared learning. So you might be able to bring a Spark training to them. We also have one developed specifically for dental practices and dental providers about how they can make improvements in their space, but they might look to you as experts, or they might look to your youth council, more importantly, as experts to see if you might be able to provide some additional training and how they can kind of up their game when it comes to youth-friendly care. And finally, feel free to connect with us after this webinar if you've got questions or ideas about how they might work in your setting. And if you do schedule one, let us know how it goes. We'd love to hear from people across the country about their experience. So I want to take some time to talk about some additional resources that have strategies for building the dental center capacity, as well as how you as providers might be able to make referrals. So AHI offers a number of starter guides, and we have one shown here on building dental practice capacity to serve adolescent patients. So as Ellen mentioned in the spark, it talked a little bit about what are some of the main areas where youth might be assessing the youth friendliness of the dental center. So one of the things that we highly encourage is, as somebody mentioned, really getting feedback from the young people you serve to get a sense of, have you been to the dentist, or if you go, what are you really looking for? And there's lots of information that they can provide to you on how they experience care and what might make that better. And so some of the strategies that are involved in the starter guide, which is really a mini toolkit to provide concrete, actionable steps to take. It includes workflows and links to additional resources. But some of what it will talk about for increasing oral healthcare utilization is making services accessible to youth, and what does it really look like to create a welcoming environment. How can providers and dental practitioners use strengths-based approaches to care? So, encouragement of, if somebody is, if they're flossing, once a month, which I think is probably pretty typical. I can share all of my experiences from my dentist appointment this week and with my children. But if you go and someone says, that's really great, that you floss once a month, let's figure out ways that we can encourage that. What are some of the things that work well for you when you are able to make time to floss? So as you as providers know that a strengths-based approach can really be impactful. And avoiding using jargon, really making sure that patients have an understanding of what is going on. Encouraging adolescents to return for follow-up care and collecting their feedback. Oftentimes when we go in for services, or young people go in for services, their parent or guardian is the one who fills out the form and questionnaire. So having a youth-specific feedback form is really valuable, and we provide samples of them in the starter guide. There's also some great information and resources about the specific care for pregnant adolescents and how that can look in a dental practice, as well as providing care for adolescents with special health care needs and adolescents who use tobacco or other drugs. And what you as a provider, how you might have conversations with those patients who you identify with substance use, and why and how that is seeing a dental provider would be beneficial for them. So this other resource that we have here is a poster that can be downloaded from our website and posted in your health center. And as a reminder to patients, parents, and providers about the importance of routine oral health care for adolescents. It's one of the many youth-friendly posters we have available for health centers on our website. While you're on the site, I would encourage you to check out the free webinars, training videos, and information on the adolescent-centered assessment process, as well as our youth-led assessment process, health center assessment process. These are tools that we've been using with health centers across the country to really help enhance their environment and their policies and their practices related to adolescent-centered care. So one of the things I will share from my experience at the dentist this week and talking with my hygienist and talking with my dentist as well, was they felt like their practice was fairly adolescent friendly, very patient-centered for sure. And we were having a conversation about if you had a patient that you suspected, or you could tell had an eating disorder based on the appearance of the enamel on their teeth, what would you do about that? And so one of the things they said was, well, we try to talk to the patient. And I said, okay, do you have a process or a workflow in place for seeing that patient alone if they have come with a parent or guardian? And that wasn't something they had really thought through. Additionally, they said, well, we try to refer them back to their primary care provider, which I think is obviously a great strategy. But I also asked, are you aware of, the resources that are available in your state and what services that minors can access without parental consent or knowledge? So for example, if a patient has an eating disorder and could maybe be served by seeing a behavioral health therapist, do you know what the minor consent laws are in your state to be able to say, you have access to these services? And because the laws are fairly nuanced, and because they're different in any state, one of the talking points that we always try to give to dental providers is encouraging them to contact the primary care office or their school-based health center to say what services are available. And I bring this up knowing that for the people on the webinar today, that not all of you work in a dental center. I think most of you work in a primary care or school-based setting. But when you're reaching out to practices, knowing who to refer to and who to put in your referral guide, having those kinds of relationships where you've met the people. We often encourage folks to do, kind of lunch and learn opportunities, or to reach out, or to have take your youth group over to kind of do an assessment as a way to sort of build some of those relationships and make sure that the providers are aware that you are a real resource to them in caring for their teen patients, and that patients feel that this is sort of a team-based approach to care. So finally, I wanted to say that at the Adolescent Health Initiative, we provide technical assistance and coaching and consulting on a number of different topics. I hope everyone will kind of go to the website, peruse a little bit, see what is available to you. And then also just wanted to mention our annual conference on adolescent health. I know we've seen a number of you there in the past. This year is taking place on April 11th and 12th in Detroit, and registration is going to open in January. One of my favorite things about this event is that it is co-facilitated by young people. Half of the sessions have direct engagement from youth councils from around the country. So it provides a really wonderful experience for the multidisciplinary audience that attends. And if you have any questions, we're happy to take them now, or please feel free to reach out to us, and you can get our contact information through the website after this webinar. And thank you.
Thank you so much, Lauren and Ellen. At this time, we are open for questions, so please put your questions into the chat box, and so that we can continue this conversation further. And while you're doing that, we have a few announcements that we'd like to share, one of which is about our membership. The School-Based Health Alliance works to improve the health and status of children and youth by advancing and advocating for school-based healthcare, and trainings like this webinar would not be possible without the support of our members. In addition, you receive exclusive access to valuable program tools, timely publications, and networking opportunities. So take a moment after this presentation to visit www.sbhforall.org/membership for more information and to join. Along with the wonderful resources from the Adolescent Health Initiative, the School-Based Health Alliance offers a school oral health resource library designed to help strengthen and expand school oral health services. Its resources are organized around 8 components of school oral health, covering everything from articles and assessments to webinars and websites, and can be tailored to various audiences. So please visit our website to access all of these materials. So now we'll go back to our questions. There's one from Sandra Flores. Are you aware of confidential visits for dentistry?
No, so when talking with the dental providers that we have spoken with around the country and developing the materials, most of them said that they don't offer confidential services, but that they would look for opportunities to speak confidentially with a patient if issues come up. So they're screening for, they screen for abuse and for violence. So if they notice broken teeth or a bruised palate, like I mentioned before, they can often detect eating disorders. They can detect certain STIs or substance use, so that they look for opportunities to sort of speak with the patient and refer back to the primary care provider or the school-based site.
Thank you. The next question is from Elsa Pepe. She would like to know about friendly forms for students in high school that are more elevated, not as kiddie, for questions and enrollment, and of course for any resources for parents and guardians.
Yeah, so I think what you're looking for is, in terms of a form, like a screen, are you talking about a screening form or a form to receive service or dental services? You don't mind chatting in a little more information? To receive dental services. Yeah, so I think in the starter guide that we provided, There's some sample forms or sample questionnaires and surveys for patients. So you can access it through our website, or I believe you'll have access to these slides afterwards, so you'll be able to click a link.
Yes, everyone will have access to the slides and the recordings once it's posted, and we'll send out a link.
You're welcome.
Any other questions at this time?
Great. Well, thank you, everyone. Again, the intention for today was to really get people to start thinking about what you can do in your own health center to have systems in place for not only referring patients, but for determining which dental practices in your community are providing youth-friendly care. So this is an opportunity to kind of take some of these starter questions and bring them back to your site and do a little bit of action planning, and then maybe look into some of the follow-up resources that the School-Based Health Alliance has, as well as what we provide on AHI's site.
Thank you all so much for answering those. At this time, we'd like you to also take a moment to answer the evaluation polls that have posted up on your screen right now. And also, we want to thank so much to Ellen and Lauren for a wonderful presentation today and providing all of this great information that you can take back and connect with them further, or connect further with your own teams on dental health service referral. We'll give you a few more seconds for the evaluation. Otherwise, have a wonderful day, and thank you so much for joining.